Well, hello class. Welcome back to Kinesiology 557 here at Cal Baptist University. We are nearing the end. Thank the Lord for that. And we're going to go ahead and start on our CAP assignment. So the first thing that we're going to do, by the way, my name is Dave Gloria. This is my wife, Jamie, who has been with me throughout the entire journey. Thank you, Jamie. And we're going to go ahead and start with a resting heart rate and a resting blood pressure to begin our CAP assignment. So I have my stopwatch here. I have Jamie's radial pulse, and we are going to count how many beats per second for 30 seconds and multiply that by 2 to give us our resting heart rate. And we'll start now. Okay, so we went ahead and got the heart rate at 30 seconds. So it was 32 beats per second. We multiply that by 2, that gives us 64. So Jamie's resting heart rate is at 64 beats per minute. Quickly, when we're taking our radial pulse, it's on the thumb side, okay, where the radial bone is, and that's how we find our radial pulse. Okay, we'll be doing the blood pressure next. Okay, class, and now we are going to take Jamie's blood pressure. And so we have our BP cuff, we have our stethoscope, okay, and we have our gauge here. And so we are going to go ahead and perform that now. We need to find that brachial pulse. Okay. And we'll begin taking the blood pressure. Okay, so Jamie's reading was a systolic reading of 118. The diastolic was 80, so she has an overall blood pressure of 118 over 80. Welcome back, class. Moving on, progressing through our test, we are going to do now a 3-site skin fold test, which is going to measure lean body mass. And so we're going to do, we're going to go at the tricep, we're going to go at the suprailiac, and we're going to also test the thigh. So for the first test, we're going to do the tricep. I'm going to use our Gulick tape measure. Okay, we're going to start from the top of the acromion to the bottom of the elbow, and we're going to find that midpoint. So I have 14 inches. Okay, so we're going to find the midpoint, which is 7. Jamie, you want to hold here? Okay, and then we're just going to make a mark. Okay, this is dry erase, so make sure it can come off. Okay, so we put that there, find our mark. Okay, now we have our skin fold calipers. All right, so basically we want to pinch, okay, but we don't want to pinch muscle, and we don't just want to pinch the skin. Okay, we have to make sure we're getting just what we need. Okay, and that's going to give us a reading of 15 millimeters. Okay, class, now the next skin site we're going to do is the inguinal crease, or the suprailiac. It's actually the suprailiac. We're going to find where we're going to measure by finding the inguinal crease, taking our Gulick tape measure, and measuring 2 millimeters diagonal. Okay, so that's going to give us our pinch site, so to speak. Okay, we're going to go ahead and pinch diagonally. Okay, we have a reading of 6 millimeters. All right, class, for the last measurement site, we are going to do the thigh. And so how we find where our pinch site is we're going to take our gullet tape measure, and we're going to find that inguinal crease once again. So there's already a mark there, so thank you, Jamie. I'm going to hold that there at the 0 mark, and then we are going to come down to the superior aspect of the patella, or just right above the kneecap, okay? Once again, we're going to find that number. My number is 18 inches. So we're going to divide that by 2. We're going to get 9. That's going to be our midpoint. So go ahead and hold that for a sec. Okay, we're going to make our mark. Okay, and then we're going to take the measurement. So we pinch. Okay, and we come up with a reading of 7 millimeters. Okay, now that we're done taking the measurements, we are going to go ahead and take the readings, plug them into a formula, and that's going to give us Jamie's BMI. So moving on, we'll see you soon. All right, class, welcome back once again. Moving on through our test, we're going to do girth measurements now. And so we're going to start at the waist, and what we want to do is find the narrowest part of the waist. So for Jamie, my client, it's going to be just above the belly button here, or the umbilicus. Okay, and we're going to measure with our gullet tape measure in centimeters. So Jamie, hold there. Okay, and that's going to give us a reading of 67 centimeters. All right, and for the next girth measurement, we are going to take a measure at the hips, once again using the gullet tape measure, and we're going to find basically the widest area or portion of the hips, and that is going to be generally around the gluteus, okay? And so we're going to start here. I'm going to hold. Jamie, go ahead and take this around. Okay, start back where we came from. Let's move this down just a little bit. There we go. And that's going to give us a measurement of 89 centimeters. Class, for our next test, we will be doing the YMCA sit and reach. Okay, basically, this is, we're going to measure flexibility here. And so some important things just to note on this test is we want to keep the legs straight, and we want to keep them on the surface, okay? So if Jamie is leaning forward and her knees raised, okay, we can't count that as an actual test. Okay, she'll have to do it again. So we want to make sure that the knees are not flexed and that the legs stay on the surface of the ground there. Okay, so if you come in closer, what we've done is set up some parameters here. The white, where the heels are, the white tape where Jamie's heels are, represents 15 inches, and we went and did that with our gullet tape measure. Okay, so we measured 15 inches, and then what's going to happen is she's going to reach, okay, as far as she can up this piece of wood. And what we've done is designated some markers here. So this is the 20-inch mark, 25-inch mark, 30-inch mark, and so on. Okay, and so basically what Jamie's going to do is put one hand on top of each other, and she is going to reach, okay, as far as she can. Whenever her hand stops, we're going to take that measurement. Okay, so we're going to go ahead and perform that test now. Okay, class, so now we're actually going to go ahead and perform the sit and reach test. So Jamie, whenever you're ready, go ahead and we will take the measurement. Okay, perfect. Go ahead and come back. So we got a measurement reading there of 26 inches. So thank you, Jamie, and we'll move on from here. Hi class, welcome back to Kinesiology 557 here at Cal Baptist University. My name is Dave Gloria, and this is my wife, my client. You can't see her right now, but you will see plenty of her as we progress through our assignment. So the first barrage of tests we are going to do are flexibility tests, and we're going to start with a degree angle reading at the knee joint. We have our goniometer to take that reading. And so just a couple of things here. We always need to find an axis line or a midpoint. Okay, for the knee joint, that is going to be the greater trochanter of the femur. So we need to know our anatomy so we can palpate that right there. The other thing is always when using a goniometer, the measurement side, okay, is always going to be the moving side. Okay, the other side is just going to line up, okay, at the midline of the joint that we are measuring. So we have found that greater trochanter. Okay, what I'm going to ask Jamie to do is go ahead and flex at the knee. Okay, we palpate here. Okay, we come to the midline. And we come to the midline here. That gives us a reading of 112 degree angle. Okay, class, welcome back. The next angle reading we're going to do is going to be at the shoulder joint. So I'm going to have my wife shoulder flex or go through shoulder flexion, okay, and bring it back as far as she can. Okay, so we're going to find that axis point as soon as she is in the furthest position of shoulder flexion. Okay, which is right in this area here. We're going to find that midline or that axis point, which is going to be the lateral midline of the thorax. So let's go ahead and find that. Move our goniometer in such a way. Okay, line it up. Okay, and that's going to give us a reading of 180 degrees. All right, class, for our next degree angle reading, we are going to get a reading at the elbow joint. So once again, we find that axis point or the midline there. Okay, and that is going to be the lateral epicondyle of the humerus. Okay, so we're going to go ahead and palpate that, find that. Bring our goniometer to that place. I'm going to raise the arm just a little bit. Perfect, so we're on line. Jamie, go ahead and flex about 90 degrees. So this is just a good parameter of knowing that everything is in line. So we are at 90 degrees here of elbow flexion. So Jamie, go ahead and continue to go. Flex, we're going to move this here and line up about the midline of the radius. And that is going to give us a reading of 140 degrees. Okay, class, for our last goniometer reading, degree angle reading, we are going to take a measurement at the hip. So once again, we're going to find that axis point, which is going to be the greater trochanter of the humerus. So we're going to palpate here, make sure we're at that axis line. And then what I'm going to have Jamie do is flex at the hip. So you should go ahead and flex the hip. Okay. Make sure we go right about to the midline of the lateral shaft of that femur. And that's going to put us at roughly, well, not roughly, right at about 100 degrees. So we have a 100 degree angle reading for the hip. To perform the push-up test. And so some things we want to look for here, first and foremost, is our technique. Okay, so we don't want to see elbows flaring out as we're doing push-ups. We want to keep the elbows in, okay, tight and next to our bodies as much as possible. Okay, for this test, we will need to see the chin touch the ground completely. Okay, and things we're looking for: no saggy back. Okay, and we don't want our butts in the air to compensate. Okay, how this test is performed is we need to see a fluid movement. Okay, fully extending at the top. Okay, chin touching the ground at the bottom of the movement. Stomach should not be hitting the ground. And when you want to do this in a fluid rhythm, once the technique starts to come out of line, or we start seeing things that are not in line with the test, we'll stop the test, or my client will just stop when she is ready to. So we're going to go ahead and keep all those things in mind as we start our push-up test. Okay, so Jamie's going to go ahead and do the modified push-up test. Okay, whenever you're ready. Okay, good. Good technique. Everything looks good so far. We're at 3. Back looks good. Elbows aren't flared out. Chin is hitting that ground. Everything's looking good. Where are we at? 7. Okay, make sure we communicate. Make sure your client can keep track of the reps. Okay, we want to be in communication with our clients as they go through this test. Make sure those elbows don't flare. Keep those elbows in. Much better. Okay, back looks good. Okay, it's not sagging. Okay, the butt is not up in the air. Okay, chin is still hitting that floor. Stomach isn't hitting the ground, so everything is looking good at this point. Okay, where we're at?
20.
We're at 20. Okay, make sure those elbows stay in as much as possible. Good. 21.
22.
23. 24. 25. 26. Excellent. Okay, and that will conclude our push-up test. Okay, class, so for the next test that we're going to do is the sit-up test, or the curl-up test, followed by an immediate heart rate and blood pressure. So for the curl-up test, you can see we have tape here as some measurements here. So we need tape, and we need to measure those 3 inches apart. Okay, for these purposes, every time my client curls up, she's going to keep her chin tucked in. Those fingertips need to reach the second piece of tape. Okay, so some common faults here is straining too much to get up, and so the neck will strain, and we want to stay away from the neck, so we want to keep that chin tucked in. Some other common faults are having the head not touch the back of the surface, so the head has to come all the way back. Okay, and some other common faults, of course, are the fingertips not reaching that second piece of tape, which generally happens with fatigue or towards the end of their test. So keeping all those things in mind, you can hear a metronome in the back at 40 beats per minute. And so that is the rhythm Jamie is going to be going at. So for instance, up, back, up, back. So Jamie, whenever you're ready, follow the metronome. 1, very good. 2. Good, so we're making sure that head touches back. Keeping track?
Mm-hmm.
Okay. Okay, we're making sure that the feet stay on the ground. Another common fault as well. Those feet will raise to try to get some extra momentum. Okay, the back staying flat on the ground as she curls up. And again, not straining that neck, okay? Keeping that neck relaxed, keeping that chin tucked in as much as possible. And of course, fingertips coming across that second piece of tape. Okay, where we're at?
16.
Okay, we're at 16, moving right along here. Okay, it's also important to breathe. Okay, so as we are doing this test, make sure we are breathing. Okay, inhale through the nose, out through the mouth as much as possible in that way. Okay, good. And again, we're going to the rhythm of the metronome. Okay, so those fingertips hit that second piece of tape at the top, and the head goes back to the surface at the bottom. Where we're at?
29.
29. Okay, again, important, make sure we're looking at technique as fatigue starts to kick in. Make sure you're communicating with your client. they're communicating with you. What are we doing there?
39.
We're at 39, 40, 1,
This is 41.
42. Okay, so I think we stopped at 44.
43.
43 curl ups. Okay, technique looked great, everything looked great. Now we're going to get up and do a quick post heart blood pressure and heart rate. Okay, class, we are now going to take a post heart rate and blood pressure, and we're going to go ahead and start that now. Okay, so let me go ahead and calculate this real quick. Okay, so we had at 30 seconds, we had 38 beats per second. So we're going to go ahead and times that by 2. That's going to give us 76 beat per minute post heart rate after her curl up test. Now we're going to go ahead and do the blood pressure. So go ahead and stop. Okay, class. And now we're going to take our post blood pressure. Find the brachial artery, our brachial pulse. Okay, so we have a reading of 130 systolic over a diastolic of 90. So we have an overall post heart rate of 130 over 90. In class, that will conclude our CAP assignment. Thank you for watching, and I am so glad that this is the end. I'm sure you are too. Thank you, Dr. Stone, for all of your instruction, getting us through this far. And again, this concludes our test. Thank you, and God bless.